Hello friends, today we are going to discuss about specific learning disorder, also called as developmental learning disorder. This is the part 2. To watch part 1, please visit my YouTube channel. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at NIMHANS, Bangalore. In this video, I'll be introducing specific learning disorder, prevalence, assessment, management, and remedial measures for specific learning disorder. Language is a vehicle of communication, expression of needs and thought. It is a medium of learning, a tool for social interaction. It's very powerful. That means to be in the society and successful, one need to learn the language. That means you need to be very specific in certain cognitive skills, achieve them to be successful. Here, there are certain disorders, like specific learning disorder. This is an umbrella term for a group of neurodevelopmental disorders that are typically diagnosed in early school-age children, although may not be recognized until adulthood. They are characterized by persistent, the word persistent, in at least one of the following: reading, writing, mathematics, or mixed. Here, as I mentioned earlier, the language. To learn language, one need to learn to read, write, express, and also to know calculation. Specific learning disorder, in which the normal pattern of skill acquisitions are disturbed from the early stage of development. But however, the person will have good intellectual or average intellectual performance. In this regard, that means there is a discrepancy between the cognitive ability and also learning ability. So there are three important learning disorders which have been classified across all diagnostic categories. One is dyslexia, dysgraphia, and dyscalculia. Most people associate intelligence with the ability to read and write, but it is not so. People with specific learning disorder are also intelligent. They have very specific disorder or disability. So what is that specific for as specific in specific learning disorder? A specific learning disorder means difficulty in specific processing areas in the brain, as opposed to the global difficulties in children with intellectual disability. As the name suggests, specific learning disorder, it is only specific areas of the brain are not working or disturbed. Whereas in intellectual disability, the world term called as mental retardation, is a global underperformance. SLD refers to a significant deficit in learning due to a person's inability to interpret what is seen, what is heard, or to link the information from different parts of the brain. This is the hypothesis which has been put forward specifically for specific learning disorder. Here, they have difficulty to perceive what they see, to comprehend what they hear, to link the information, and coordinate those information in the brain. So, what is the prevalence of specific learning disorder? There was a meta-analysis conducted in India in June 2022. This had 6 important studies of SLD, comprising of 8,133 children. The systematic review reported 8% of the children suffering from specific learning disorder. However, the studies subgroup analysis could not be done. As you know, majority of the India is still in rural areas. In the rural area, there is almost near zero awareness of learning disorder and practically no assessment or remedial facilities available. That means majority of the children who are in the rural area do not get any support. Further, no other disabling condition affects so many people and yet has so low public profile and low level of understanding as SLD, and also very low availability of remedial measures or resources in the community. Let's move into the management of specific learning disorder. One of the important principles of specific learning disorder is do not displace the child. The child should be rehabilitated within the school is very important. That means one need to make attempts to have increased opportunity, accommodation, modification within the school, that is within the community where the child learns. If at all you need to add home based also. That means combination of school based and home based should be the intervention remedial measures occurring. Only the topmost of the pyramid should go to clinic based or institution based rehabilitation or remedial measures. So the important principle is one need to have community based remedial measures and there should be minimum displacement of the child. Diagnosis of SLD is done by various categories of information collected through collateral sources like observation of the child, interviews of the child, sibling, and parents, taking family history, looking at the school notes, what the child has written, homework assignments, exam answer sheets, marks card, school teachers report. Combination of all these will be used to diagnose SLD. However, neuropsychological testing may be used to help to find the best way to help the individual with specific learning disorder. In a country like India, SLD neuropsychological assessment should be used for disability assessment and getting disability benefits. What are the reasons for consultation? Usually, the parents bring the child, especially from the urban area, to the pediatrician, to a doctor, or to a psychiatrist for following reasons. One is either behavioral problems, emotional problems. Many a time there will be school refusal, oppositional defiant disorder, conduct disorder, depression, anxiety, separation anxiety, substance use, and many a time academic decline. This academic decline can be present as the child being lazy, stupid, trouble creator, procrastinator, and parents will be insulting the child in any given opportunity in a public place. However, sometimes the referral can also occur from the schools, colleges. There may be because of academic decline, difficulties, poor marks, failure, writing slowly, not completing the homework, poor handwriting, poor writing task, spelling mistakes, reading slowly, reading by word, reading without punctuation, mistakes while doing arithmetics, and so on. That means the school will refer invariably with regard to academic performance, very rarely with regard to behavioral problems. Assessment procedure. If you undertake, parents' consent must be obtained before evaluating the child. Parents must be involved in planning of assessment, and remedial measures or any intervention that is to be taken place. Without parents, please avoid. If there are no parents available, take permission from the legal guardian or from the school authorities. Ideal assessment procedures is elaborate, may require more than 2 to 3 settings. In single session, if you do it, invariably child will score very less because of attention deficit, because of the child may be exhausted, or else the child may be sleeping in the afternoon. So for various reasons, it's worth doing multiple sessions. giving frequent breaks so that the child performs at his best. Assessment and certification of SLD requires time. So the parents or the guardians should know it takes time. At the same time, the remedial measures or interventions or the treatment or rehabilitation takes time 2 to 3 years to see the child starts improving. What are the assessment we need to plan? First and the foremost, one need to take the history, look at the complaints, how these complaints have been progressing. At the same time, history of any behavioral problems, emotional problems, schooling history, how the child was scoring, any history of school refusal, separation anxiety, family history of any neurodevelopmental disorder, either on the father side or the mother side, any psychiatric illness or neurological disorder. Check for the child's peer relationship, any chronic medical condition, past history of any evaluation and intervention on the child, family awareness and perception of the child's problem, behavioral observation of the child, mental status examination of the child is essential. At the same time, when you're doing the detailed evaluation, informal assessment of reading, writing, spelling, and arithmetics can be done. Physical examination of the child, especially neurological examination and sensory system examination, especially hearing and whether they are able to see properly. Screening for common comorbid conditions such as attention deficit hyperactivity disorder, ODD, depression, and anxiety disorders should be done. At the same time, try to get the reports from the class teacher and homework assignments and child's notebook. Invariably, there are two formats of SLD assessments. One is criteria reference test, another one is norm reference tests. What is this criteria reference test? This is scored according to a standard or a criteria decided by the school or the test publisher. That means the cutoff is already clearly determined and also on that basis it is done. Whereas norm reference test, scores on these tests are not interpreted according to the predetermined or absolute criteria or standards, but on how the students performs compared to the norm of the group. Both this approach of format as positive and negative, depending upon what type of children we are assessing, whether there is a standardized test is available, in the same mother tongue language this test is available, and also whether the tool has been validated and sensitivity and specificity tests are clearly published. If you look at these criteria, many schools of assessments or various institutions use discrepancy of 2 years between the ability of the child and performance as a mark of SLD. That means if the child is studying in 10th standard and has intelligence above average, but the child has the mathematical ability of 8th standard, that means the child has dyscalculia. That means 2 years difference is essential between the cognitive ability versus performance in specific learning ability. Look at the psychometric tests which have been said. The psychological test should include both cognitive ability, that means whether the child has average, above average, or very intelligent child, versus what is the academic ability of the child. The discrepancy between the cognitive ability, that is the intelligence, versus academic ability, that means to diagnose SLD, the child's cognitive ability should be greater than academic ability. If you ask parents, they will be saying, my child is very intelligent. He knows how to solve the problem at home, outside the home, and is very, very sharp. But however, in studies, he's very poor. That clearly indicates the child is intelligent but has difficulty in academics. There, you should have a suspicion towards SLD. What are the cognitive abilities or IQ testing done? Assessments of the child's level of intelligence by measure of IQ can be done by various standardized tests. It can be Binet Kamat test, or what we simply called as BKT test, Alliance Intelligence Scale for Indian children, that is MISC, which is usually used in India, Wechsler's intelligence test. So these are the commonest IQ test that is utilized. Further, you can use SLD assessment tools such as NIMHANS SLD assessment battery, wide range achievement test, test of written language, Wechsler's individual achievement test, Kaufman test of educational achievement, Peabody individual achievement test revised now, Aston index battery. There are various batteries are available. In India, the NIMHANS index for SLD is used for SLD certification as per RPWD Act. If you look at the NIMHANS index for SLD, it has level 1 and level 2. Level 1 is used for 5 to 7 years and level 2 is for 8 to 12 years. Here, this assessment is administered by the clinical psychologist or the special educators who have been trained in using SLD assessment battery. Here, in the level 1, the assessment of pre-academic skills, attention, visual and auditory discrimination, visual and auditory memory, speech and language, visuomotor and language, writing and number skills. That is the level 1. In level 2, areas of attention, reading, spelling, perceptiomotor, visuomotor integration, memory and arithmetic skills. This battery is used for SLD assessment to monitor the remedial procedures what has been undertaken. Wide range of pertinent tests are covered in this NIMHANS battery, easily available, administered, good for early identification of learning issues, and it is paper pencil test. But however, it has its own merits and demerits. Here the assessment is done between 5 to 12 years, available in limited languages. And please remember, before you do SLD intervention and also SLD certification, check for comorbidity. Here you need to understand, in SLD, that is specific learning disorder, comorbidity is the rule. That means 70% of SLD children will have one more psychiatric diagnosis. Hence, you need to identify and treat them. Without that, you will get a false SLD certification. That means either it may be very low or else may be high. Let's understand through this flow chart. First and the foremost, this flow chart I have taken from Indian Journal of Psychiatry. Dr. Hinal Shah has published the guideline for SLD assessment. Please go through that wonderful article. Here the child comes with either from the referral from the school or from the parents. Before you start the assessment, talk to the parents. Counsel them. What is the number of sessions? What is the outcome? When does the certification is done? And also whether there are any comorbidities. To get the school report, the child's homework book, various other whatever requirements is there, talk to them, clarify their doubt. And during your detailed evaluation, check for comorbidity. At the same time, if you have any suspicion with regard to child's hearing ability and vision, please refer the child to the ENT and ophthalmologist before you start SLD assessment. Sometimes, if you suspect any kind of physical problems with the child, please do refer the child for pediatrician also. Please remember, before you go for SLD certification, parental counseling and attempt for a remedial measure for a reasonable period of 6 months is essential. This is because the current diagnostic criteria, either you take ICD-11 or DSM-5, they clearly mention to differentiate between the specific learning difficulties versus specific learning disorder. One need to give a reasonable degree of remedial measures to be done. If the difficulties go away, that means the child does not fulfill the criteria for SLD. That means before you do the assessment, one need to make a remedial measure attempt has to be done for a period of at least 6 months. So, step 1 is to look for comorbidities. At the same time, step 2 to look for the physical comorbidities, referring to opthal and hearing, ENT, and step 3 for referring to pediatrician. Before we move further, parental counseling and remedial measures to be undertaken. Once, after 6 months also, if the child does not improve, then the cognitive assessment should be attempted. That is IQ assessment. And second step, then the next step also should be assessment of academic achievement. That means if the child is IQ is more than 85 or else average or above average, then only SLD assessment has to be started. Imagine if the IQ is less than 85 or the child qualifies for mild mental retardation. The diagnosis of SLD cannot be done. That means the child IQ should be normal. If the IQ is normal, then only you will be doing specific learning disability assessment. And now, once you have done the assessment, again, you need to sit with the parents, counsel the parents, prepare a report, send the report to the teacher, communicate with the teacher if possible, if the teacher is available, and the school campus has a very good psychologist, special educators. So, implement of management can be done at the school level first and next at the home. That means you need to plan with the minimal displacement of the child. That is very essential so that modification, accommodation can be planned and the child is displaced very less. If in spite of that, if the child does not improve, then only it has to be referred for special educators or maybe for the institutional based remedial measures. Let's discuss about the SLD certification. As I mentioned earlier, before you do SLD certification, you need to check for comorbidity because comorbidity is the rule. Treat the comorbidity. Reasonable degree of remedial measures has to be undertaken for at least for 6 months to differentiate between difficulties and disorder. Unfortunately, in India, the parents or the school will refer the child like before the exam, during the exam, or else after the exam. Please understand, parents and also the teachers. SLD assessment is not a cross sectional assessment, it is a process assessment. That means it takes a longitudinal assessment. And here we are dealing with the child. And before you certify, please do a longitudinal assessment. Let's look into the what are the management remedial measures. First one is accommodation. Here, accommodation means different ways of children to take information and communicate the knowledge back. Here, the changes do not alter or lower the standards or expectation for a subject or test. That means the child, suppose he has to pass 8th standard, the required expectation is not changed. That means the goal will be the same. However, to achieve that goal, accommodation procedures will be taken, such as the child will be allowed to take repetition of the class, slow pace of class, extra classes. Child can be augmented with digital technology, maybe laptop, tablet, maybe using technology touchpad, multisensory writing, animation based teaching, and various other accommodation measure is done, but the goal is not changed. Recording the notes, providing notes, extra classes, extra time. Here, the accommodation with regard to the process, not the expected outcome. Whereas modification is where the task and academic expectation from the child are changed. That means the process will be there, but the outcome can be changed. Here, the results in changing or lowering the expectation and creating a different standard for kids with disability than for those without disability. That means you are going to change the goalpost here. You will make the goal easy. That means you will modify the goal, such as extra time, or the child is allowed to get the scribe, or else the child is giving only MCQ test, and the child may not be penalized for spelling mistakes, or You will be giving extra time, exemption from second language, exemption from mathematics such as algebra and geometry, reservation for seats and jobs. That means the outcome variables are changed. That is the modification which is done. Further, remedial measures are taken. Remedial measures means it is a process to help the child to acquire age appropriate skills in all his foundation areas which are required for attaining the knowledge at his pace and potential. That means here you are doing the rehabilitation. Instead of rehabilitation, we are using the remedial measures because the child is suffering from neurodevelopmental problems. Remedial measure is not a one sitting, two sitting. It is not done individually sometime, or it may be done in a small group. The best is done in individual. That means one to one. Many a time, because of the lack of resources, you may consider 2 to 3 children in a small group. Best is done at the school or at the home, or very rarely at the clinic of the clinical psychologist. Each session may last for 45 minutes to 1.5 hours sometime. 2 to 3 sessions per weeks, and these sessions will last for 2 to 3 years. Please remember that. It is not that if the child goes for 6 months and you have paid the money and you do not accept, if you don't find any changes, don't be disheartened, because the child is developing, the child is growing, the child's brain is growing. Give time, and the remedial measures should be ongoing. If you look at this chart, let's go through that. As I mentioned in the part 1 of my video, there are 3 important SLD classification. One is reading disorder, that is dyslexia, writing disorder, dysgraphia, and mathematics, dyscalculia. Whenever there is a reading disorder and you are able to find there is dyslexia or difficulty in decoding, you'll be doing phonological training with letter sound training, phonic reading instruction. If there is reading comprehension problem, improving the vocabulary and meaning, targeting oral language comprehension. If the child has reading fluency, guided oral reading and phonic instructions can be done. If the child has writing problem, that is dysgraphia, younger age of motor task will be done, orthographic tasks to improve the retrieval of letters from long-term memory, training for higher order of skills such as planning, organizing, executing, and proofreading. And finally, the mathematics. Here, training in number syntax, drilling, split instruction, teaching verbalization, general strategy of problem solving, so that the child learns in the real life. The mathematics are taught in real life. That means by play, by games, maybe sports, going to various shopping complex and there asking the child to count or else to deal with the money. In such a way, you'll be teaching the child in the real world. With regard to disability certification, I'll be doing a separate video for certification because many family members, parents, and teachers want to know about SLD certification. Hence, a dedicated video I'll be doing. Please do go to my YouTube channel, subscribe, and see those videos. What are the future challenges in specific learning disorder? At this point of time, we do not have a standard screening tool for SLD across the country. And also, it is not translated across many languages. Cultural adaptation has to be done. And even along with that assessment instrument for SLD, remedial measures or kit is to be standardized. And also, the human resources for remedial measures are very poor, both for assessment and treatment. Keeping in this diverse population of various languages, schooling, rural area, and dialect, culture, age group, at India we have an enormous mammoth task. We have children below 14 up to 30 crore. And if you have 10% of the population suffering from SLD, somewhere around 2 to 3 crore population of children having SLD. To conclude, my dear friends, prevalence of SLD is very high. Comorbidity is the rule. During your assessment, check for comorbidity. 70% of the SLD children have various internalizing or externalizing disorders. The best way for remedial measures in SLD is early detection, early intervention, and displacement of the child should be as minimal as possible. Please do the remedial measures in school, at home. Of course, if the child is having a severe SLD, the child may require clinical intervention by the professionals. And also special training outside the classroom should be given only for these severe cases. So that means some of the child may require long-time remedial measures. Thank you very much for giving your valuable time. Stay safe.